How do BRCA gene carriers make proactive medical choices? Imagine knowing you carry a gene that could increase your chances of developing certain cancers. That knowledge can feel overwhelming, but it also opens doors to taking control. When someone has a BRCA gene mutation, they have a higher risk of breast, ovarian, and other cancers. These mutations impair the genes that normally help repair DNA damage, which means the body struggles to fix certain cell changes that could turn into cancer. For women with these mutations, the risk of breast cancer can be as high as 72%, and ovarian cancer risk can reach 50%. Men with BRCA mutations also face increased risks, especially for breast, prostate, pancreatic, and melanoma cancers. So, how do carriers make smart choices to stay ahead of these risks? First, they often start with more frequent and earlier cancer screenings. Women might have annual breast magnetic resonance imaging scans and mammograms starting in their late 20s or early 30s. Men may get regular clinical breast exams from age 35 and prostate screenings around age 40. Skin checks are also recommended yearly because of the higher chance of melanoma. Some carriers opt for medications called chemopreventive drugs. These include tamoxifen or raloxifene, which can lower the chance of estrogen receptor-positive breast cancer. These medicines are prescribed based on personal risk factors and can be part of a plan to reduce cancer chances without surgery. Many choose preventive surgery to cut their risk significantly. Women often consider removing their breasts through a procedure called risk-reducing mastectomy and removing their ovaries and fallopian tubes in a surgery called salpingo-oophorectomy. For BRCA1 mutation carriers, doctors usually recommend having the ovaries removed by age 40. For BRCA2 carriers, the timing might be between ages 40 and 45 or after they finish having children. These surgeries can lower cancer risk by more than 90% but requiring careful planning and counseling. Genetic counseling plays a big role in helping carriers understand their risks and options. Counselors explain test results and guide decisions about screening, medications, or surgery. They also support emotional well-being during this process. Because BRCA mutations are inherited, carriers often talk with family members to encourage testing. If relatives also carry the mutation, they can start their own screening and prevention plans early, creating a proactive approach within the family. In the Jewish community, especially among those of Ashkenazi Jewish descent, BRCA mutations are more common. This makes awareness and early testing especially important. Many Jewish families seek genetic counseling to understand their inherited risks and make informed choices that align with their values. Overall, carriers make proactive choices by combining early screenings, preventive medications, surgeries, and family communication. These steps help catch cancers early or prevent them altogether, giving carriers more control over their health and future.